Hello, welcome to the COMLEX 5-minute review. Please visit comlexflashcards.com for even more information as you prepare for the COMLEX board exam. Today's topic is going to be routine newborn care, also birth injuries experienced during deliveries. For routine newborn care, we want to look at the APGAR score. Just some key points here before we get started is that, the APGAR scores are done at 1 and 5 minutes. The 5 things you look at are the heart rate, respiration, color, tone, and reflex irritability. If the patient has less than 100 heart rate, irregular shallow gas, pale blue extremities, weak passive tone, facial grimace, then the patient would get 1 point for each of those. However, if the patient has greater than 100 heart rate, the patient is crying, pink, active tone, and active withdrawal, then you would give the patient more than 2 points for that particular set of symptoms. Now, the APGAR scores are done routinely at 1 and 5 minutes, and every 5 minutes thereafter, as long as resuscitation is continuing. The 1 minute score gives you an idea of what's going on during labor and delivery, and the 5 minute score gives you an idea of response to the therapy. In general, the APGAR score is not predictive of outcome. However, scores between 0 to 3 at 5 minutes and longer compared to infants with scores of 7 to 10 have a worse neurological outcome. In routine newborn care, it's important to treat the cord with a bactericidal agent such as a triple dye or bacitracin. Once the temperature of the patient is stable, you want to cleanse the skin and umbilical cord with warm soap solution and then rinse the infant. The eyes should then be treated with 1% silver nitrate drops or 0.5% erythromycin ophthalmic ointment, and also administer 1 mg of vitamin K IM to prevent hemorrhagic disease of the newborn. Let's take a look at some of the common birth injuries during deliveries. First off is subconjunctival hemorrhage. This is a condition where a patient develops sudden increase in intrathoracic pressure as the chest passes through the birth canal. It's not a problem, it will resolve on its own. Also want to talk about skull fractures. In utero, from pressure against bones or forceps leads to several skull fractures. They can be linear, which are the most common, or depressed, which elevate to prevent cortical injury. And there's basilar, which are fatal, with breach with traction on the hyperextended spine with a fixed head position. Let's review brachial palsy. Herb Duchenne, C5 to C6 palsy is when the patient is passing through the birth canal here and they cannot shoulder AB duct. Also, externally rotate and supinated forearm. Okay, so those are the key characteristics. Then there's Klump's-Palsky, which is C7 to C8. And here you have a paralyzed hand plus or minus Horner syndrome. Most patients do experience full recovery. It depends on whether the nerve was injured or lacerated. Full recovery over a few months versus permanent damage, again, depends on the severity. The treatment is to properly position and partial immobilization of the patient. You want to massage and range of motion exercises for the area affected. And if there's no recovery in 3 to 6 months, then neuroplasty is suggested. Then there's clavicular fractures, especially with shoulder dystocia in vertex position and arm extension in breech position. And in terms of the outcome, usually a palpable callus is palpable within a week, and the treatment is with immobilization of the arm and the shoulder. Patients also have facial nerve palsy, where the entire side of the face of the forehead has a palsy, and it's common during forceps delivery. Improvement does occur over weeks, and you need eye care and neuroplasty if there's no improvement to fix the torn fibers. This is caput succedaneum, and it's mainly where there's diffuse edematous swelling of the soft tissue of the scalp. And the important point for the boards here is that this crosses the suture line. As you can see here, it's here and then here. So it's crossing the suture line. It disappears within a few days and may lead to molding for weeks. And this is a cephalohematoma. And again, with the cephalohematoma, you have subperiosteal hemorrhage. It does not cross the suture line. So with the cephalohematoma, it does not cross the suture line. You can see here it's restricted to one side, and may have an underlying linear fracture in some patients. Resolves in 2 to 3 weeks, but sometimes it can take up to 3 months to resolve. Okay, so the caput disappears in generally few days, whereas the cephalohematoma takes 2 weeks to 3 months, and it can calcify and can also lead to jaundice. Finally, want to talk about subcutaneous fat necrosis, which occurs with a difficult delivery, and patients have perinatal asphyxia, prolonged hypothermia, and they go into hypocalcemia as one of the common outcomes of a patient with subcutaneous fat necrosis. That was a quick review of the common injuries during deliveries and reviewing some of the key facts you would need to know for the newborn for the COMLEX board exam. Please visit comlexflashcards.com for this complete lecture and more information such as podcasts, lectures, and tips on how to study for the COMLEX board exam. Good luck in your preparation.